Tonight, of course, we'll have our consideration of a candidate for the board, which will be our first item that we'll get to in just a moment. Madam Secretary, may I ask for a roll call?
Yes, you may. Lynn Finley.
I'm here.
And Paul Garza.
Present.
And Jan McGordy. Here. And Susan Savage, present.
Okay.
So we're all here.
Okay, now we have an opportunity for anyone from the public who wishes to address anything that is not on our agenda. You have a maximum of 5 minutes, and we have a potential of 20 minutes for those comments at this point. Is there anybody who wishes to address the board? Okay, no one present. Anyone online?
No.
Okay. Okay, then let's move into our board member appointment, which is no doubt the most interesting thing we're going to do this evening. Okay. So first of all, I want to announce that Gabriel Maroney has decided to remove himself from consideration. So there will only be 2 candidates. I was going to announce I thought we had 3 very excellent candidates, but now I'll say we have 2 very excellent candidates. Okay. And before we begin, I want to again make it clear to all of you that we have spent gone about this very carefully. We spent a lot of time with our attorney, got his advice on how to conduct this so that we are fully in compliance with the Brown Act and with best practices. So this first item is discussion and possible action to appoint an MCHCD board member to a vacant board seat for a term that expires upon election certification after the 11/3/26 general election. So anyone that is appointed tonight would have to stand for election in November 26. The term that they would be filling is potentially a 3-year term. Okay, but the first year, and then there would be a required election after that for the other 2-year term, for the remainder of the 2-year term. So with that, I would like to start with the process by giving each of the candidates, what do we agree on, 5 minutes, or did we say 3?
I think 3.
3?
Yeah, what we told
3
you.
minutes to introduce themselves. And either one of you care to go first? Doesn't matter.
I'll go first.
Okay. Why don't you, and Ms. Stein, would you please go to the podium? Yeah.
Okay, I can do that.
All right, is this good? All right, so I believe I submitted my resume. My experiences in project management for large financial institutions for IT. So that's what I've done. So I've taken a lot of projects from, I was basically given a lot of projects that were behind, and I got to go in with my broom and clean them up and get them on track, create a plan if there was no plan, and manage those processes, manage those projects to their successful implementation. The one project which really so disturbed me when I was a consultant, I worked for the state of California, actually, or I was consulting for the state of California, and they were revising the whole judicial IT, which was a really good idea because none of the 58 courts talked to each other. But the project was not particularly well managed, and I remember I finally had to leave. I mean, I had to leave because I could see it wasn't a success. I couldn't make it a success, and I sat on the steps of the McAllister building and cried because that's what a good project it was, what a good idea it was. They just didn't have the mechanics to implement it. And the mechanics are pretty simple. The mechanics are, you get the requirements, you make a plan, you manage to that plan, and you implement. I mean, it's pretty straightforward in my perspective. Okay, so that's my history, I guess. And the reason that I'm here is because I gathered I could contribute to this process. I'm very heavily invested in the hospital. I'm 74 years old, and I want to have a hospital here. I mean, even if they do nothing but fly me out, which is what happened the last time, it's sort of, I think they're going for a hub and spoke methodology where this is the hub and then they fly out to the spokes. So
1 minute.
1 minute, okay, well, I'm probably not even going to take 3. Let's see, let's see. Yeah, that's who I am. I've been up here since my parents bought the lot in '68. They retired up here. I retired at 55 because IT makes a good living. You make a good living in IT, as we all know. And then I came up here and sat on the deck and said, what the heck have I done? Because I quit my job and moved up here at the same time. But then I decided that I'd get involved. So, a third thing, I did the grand jury, I did the mental health board, I did a lot of, as you can see, I sent you, I've done a lot of civic activities to keep myself busy and hopefully contribute to the environment. I think I'm done, really. I'm a team player.
10 seconds.
Is that you? Is that you?
Yep, we're all going off.
Okay.
You've got your 3 minutes.
Okay. And I guess, the only thing that would sort of, the other thing that I'm involved with is I'm on the board of the hospitality house. So that's where some of my attention goes. And other than that, I'm done. Shall I ask for questions?
No.
Okay,
No.
great.
Okay.
You know what? I can take it.
Okay, Mr. Blaisdell.
Well, as you know, I've been involved with the board as an observer for the past 3 years. I've seen a lot of the changes that have come down. I'm on the planning committee. I've seen the project at first hand, and I feel I can make a difference, and that's what my interest is. My professional background is I've been a consultant in the high technology industry for 45 years. Anything involving strategy, process, people, and technology, and managing projects, all through that I've done, and I've liked it. And I think that I bring that to the board of being able to analyze a situation and come up with reasonable solutions and things that can work. My board experience, I've been on the board of 2 lighthouses for 10 years, and both of them have had major construction projects going on. With the lighthouse down here at Point Cabrillo, we are rebuilding the barn. So I've gotten a chance to see all the fun and games of permitting and all that kind of stuff. And out of the East Brother in the San Francisco area, we had to put in a septic system, and we had fun with that. That went on for quite a while. So I've seen it, I've been there, I've done it, and I'm looking forward to doing more. Thank you.
Okay, thank you.
I think you're under a minute.
Well, we never worry about efficiency here. That's a good thing. Okay, now we are going to have a series of questions that the board members are going to ask. As we will, because the answer from one person will be heard by the other person that gives an advantage, so we will be alternating who goes first, one question to the next, right?
Chair, do you
Okay.
want to time these responses as well?
I hadn't thought of that, but, well, let's see how it goes. Hopefully, we won't need to do that.
Okay, I also had a suggestion,
Jeff?
because everybody's going to want to hear who's on screen. So what if they both
Yeah, please.
stand up at the mic so that
Please, in
we
fact,
can kind of go from one person to
yeah.
another? Does that work?
Yes, it does. Yeah, that way the audience will hear what you're saying.
Bring your Nerf ball pistol.
Spit on the mic.
Okay.
Well, I'll
So-
set them for 2 minutes, and then at your pleasure, they can go on.
Yeah, and just for board members, if you feel that the answer has been given is not clear to you, you certainly can at that point ask a follow-up question. And after we get done with the questions we've all agreed on, if you have another question, you can then ask that, and we'll go through the same process. So, okay, so this is just the start. Okay, so with that, Director Finley,
I get to be the first one. What is your
oh,
familiar?
which one are you? Who's going to answer first?
Oh. We'll stay with him.
Okay, do you need to pull the mic closer to you? Because I don't know if anybody can hear. There you go.
All right, so the first question is, what is your familiarity with the Brown Act?
Oh, I'm very familiar with it. I've been in enough organizations that I've
Okay, suggestion, if you're up at the mic, because nobody can hear you if you're not.
I'm very familiar with it. I've been in a number of organizations where we've had to fill it out, so.
Okay.
Okay.
I took the Brown Act training along with you, and when I was on the grand jury, we also did some dealings with that.
Okay, good. Okay, then I guess the next question is mine. So, Mr. Blaisdell, if you'd like to take this one first, what is your 3 to 5 vision of the district's future?
Well, the first 3 to 5
Years.
years, the initial challenge is to meet the earthquake safety standards so that we keep our hospital. The second challenge is to improve the facilities so that we can offer the best health care to the coast for the next 10 to 20 years. And once you get done with that, then we can look around to see what else we could be involved in to assist the basic mission, which is increasing health care on the coast.
Okay.
Fulfilling the seismic requirements is the first and most important thing. I think as far as modernization, which is, I think, a term that the board has used a lot, that really, I mean, that's extensive. That's an extensive thing that needs to be managed properly, so it's broken down into increments where you can finish one part, leverage that off another part, and off another part. So that would entail a lot of planning. And I think we're always going to be a rural hospital. I mean, that's sort of how it is. And I think, we're going to have to plan around that.
Hey, I think this is a really interesting question, and feel free, we're all tough. What is your critique, and it looks like Emily would go first, of the current board? Be brave.
Step up to that mic.
Push on the spot. Well, I've looked at some things. We seem to be behind a little bit by about a year, and I don't know if that's true, but that's because the board was focused on modernization as far as the seismic upgrade. And I don't know if that's true. I mean, all I can do is interpret what I read. Mm-hmm. Okay. So, I don't want to see the board distracted. You need to work smart, not hard. And I would like some confirmation that we are on track. And what is the track? I couldn't find a plan, so I don't know what that track is, to be very honest with you. And a board without a plan is sort of like, a fish without fins. It's not too good. So, but I know you've hired some consultants, but I have seen many projects fail because nobody's managing the consultants. They think they can just write them a check, give them some high-level requirements, and have them go away. And usually that does not work. You have to manage a consultant just like you manage your employees. So that's where I am on that.
Well, having been around for a while and observed, the major problem that you had as a board, you don't have anymore, which was, people that should not have been on the board in the first place. Pardon me for being blunt, but that's how it was. The next thing is, managing to a plan requires that you know what that plan is. And that's not something that you seem all that experienced with, of plotting out a course and saying, okay, step 1, step 2, step 3, and how long those steps are going to take. I mean, you're all sharp people, but there was that lack of focus, and I think we wandered about in different directions. I know we did on the planning committee for a while until we basically buckled down and said, okay, we're going to make a decision. Here's what it looks like on paper.
Director McGordy.
So, how do you feel the relationship between our board and Adventist Health can be improved or more effective?
Who are you talking to?
I think it's
We'll start with
Mike.
Micaiah.
Starting with me?
Yeah.
You were the last one, so we're alternating.
Okay, that's fine. Communication, to be precise in what you need on both sides. There was some misunderstandings, for example, when there were, by terms of the lease agreement, Adventist Health had certain prerogatives that we weren't all aware of. So there was a confusion about who's doing what or who gets to make this decision and where and how does the decision get made. And, we need more precision in those regards. Who's doing what, who's responsible for what, and who takes the lead on at any given point in time.
I would parochially call that getting your requirements and working with the Adventist to get their requirements. So I really don't know the dynamics between this board and the Adventist, but I think, my neighbor, who's a doctor, says the Adventists fill a very important niche in rural hospitals. So, if we divorce them, there may be nobody else to come in. So I think that's really key to keep in mind. And I think gathering their requirements and getting clarity on whatever the lease contract was, and getting them bought in so they have some skin in the game, emotional skin in the game as far as the project. So.
Okay, Director Finland.
We'll start off with Emily, because will you be willing to run for election to this board in November of 2026?
Can't commit, won't commit.
I'm sorry, I didn't hear.
Can't commit, won't commit. I don't know what, if I am intellectually stimulated and emotionally fulfilled, I probably would run. If I'm not, I won't. So that's my honest answer.
I ran before, came in third in a four-way race for 2 seats. Would I run again? Yes, as long as we're making progress, as long as I can continue to make a difference, yes, I will run again.
Okay, Director
Yeah, I have
Gordy, I believe you have another question you want to ask?
I do.
Okay.
Yeah. So, Mikhail, what skills can you bring to the board at this time?
Project management, analysis, speaking, if we get involved in doing public presentations, I've done a number of those. Long-range planning, everything I've done over 45 years.
Ditto.
Okay, well, that's to the point. Okay, do the board have any other questions that have occurred to them they'd like to ask at this point? Because I have one final, just general, more courtesy question for the, is there anything else? Okay, then I would just like to ask, and we'll begin with Ms. Strachan, do you have any questions for us?
How do you feel you're doing?
Well, I can only speak for myself, but I think we're in a really great shape. As you'll look at the agenda package this evening, you will see a plan, a comprehensive plan for all the Sajak retrofit. And I think that's a major accomplishment. And so I think we are on track. So I think we're doing quite well. When I came on the board, every meeting was a adventure, I guess, that's the best way to put it. And you never quite knew what was going to go on, but fortunately now we have a group of very dedicated and very solid people and very serious about what we're doing, and I think we made very good progress.
Do you consider the Gantt chart a project plan?
I think it shows us, it lays out everything that needs to be done, and that was the most important thing. Now remember that we're in a process where we have to take this to HCI, and they have to approve it. That is the California, what do they call it? It's not department, they call it something else, but of health care, access and information. Right. So we're presenting it in the format that they want.
That was their requested format. So are you going to try to work from that, or are you going to put it into a format which is more management and user-friendly? That would be my suggestion.
Okay,
That's
fine.
okay.
Yeah.
Okay, so if
But
I
Mikhail
am,
hasn't answered this.
yes,
But she
Let's-
asked-
Okay, but I thought she asked us
She
a
did.
question, and I didn't know if there are others of
Yeah,
us
if other,
that
yeah,
want to-
others want to comment, sure.
Yes. And if I heard your question right, and I'm sorry, I had a little bit of trouble, is if you were asking our evaluation or assessment of ourselves and where we are. And what I would say, just my own personal opinion, is that I think we're in an ongoing conversation and an ongoing process for how to figure out how to work efficiently and effectively and still make sure that the robust evaluation and information gathering to make important decisions happens. And sometimes those two things don't dance real well together. And so I think that's an ongoing process of trying to figure out how to make that work so that everybody feels that they've had a say and has had input, but we also work efficiently and effectively.
Right, but don't you think at some point you have to freeze the requirements, freeze the scope, and march to that? I mean, I think working things out is great and getting requirements and working together is great. But at some point, like when you're building a house, you have to say to the architect, we're done.
Mhm.
Right.
So that's the only comment I have to that statement.
I think for a while, we were still trying to figure out,
Right on your mic.
we had to figure out what funds we had to work with, what
Okay.
the requirements were, and to find the architect. And I think that that's where, because I'm the newest on the board, and that's
Okay.
where I kind of feel like I walked into, is that we were trying to figure out all those pieces.
Mhm.
And until we had those pieces, we didn't really know really which direction to go in.
Okay, fair
So,
enough.
but I think that we've gotten a lot of that information and have a better idea now of where we need to go and how to get there. Not all of it, but we're working on it.
Okay,
Yeah.
thank you.
Um,
Any more questions?
Yeah, I feel like we've had a lack of focus. Like when I first came on the board, it was made clear that we needed to get a plan in by January 1st, 2026. And there's all these distractions that happen. It's like squirrel, so it's been really frustrating for me not to have a clear focus, particularly on the seismic upgrade, which is the thing that's required by the state, which is life and death for our hospital. And I still think that is not clearly in focus yet.
Well, and I'm back to scope creep. What's the requirement? A plan to get there, and after a while you say no more changes, no more squirrels, so.
Yeah, we spent a year, talking about modernization
I understand.
or a new hospital and ignoring the whole seismic, upgrade requirement.
I'm not sure your whole board agrees with that, but I hear you. I do. I hear you. Okay. Do you have any more? Oh, no, I'm done. I'm
Yeah,
done.
that's the only question? Okay, fine. If you have more, Michael?
I don't have any questions. I've been around and I've seen you all in operation, and I welcome the chance to work more directly with you.
Okay, thank you very much. Any more questions from board members at this point? Okay, now we have a period of public comment. Again, we're constrained to 5 minutes per individual. Anyone wishing to speak about these candidates and their views is welcome at this time to address the board. Okay. I assume, Mr. Maroney, you're going to address us.
Gabriel Quinn Maroney. Good evening, everyone. Glad to see that there's 2 candidates, although I would like to see a more robust pool. Oftentimes, when I talk about the healthcare district locally, people don't really know what's going on, and maybe the word didn't get out well, but I think both candidates would be fine, and they both have some solid experience. And, Blaisdell obviously has been here looking at stuff. But I would also mention that you don't have to pick someone. You do have enough people to move forward. And really, if you're going to put someone on the board, you definitely want to have someone that's going to bring a good reputation to the district, that's going to offer, knowledge. And, it's good that they're really knowledgeable about the in and outs of what has been going on, but if they're not, a really strong knowledge base that can help you all. And I just wanted to mention that you can choose to leave it up to the voters, or perhaps if it goes to the county, then there can be another call out, kind of like this is going on, is, again, kind of looking out for people. Does someone else want to do it? Anyway, you have decent candidates here, and I really appreciate all your work. Thank you very much.
Okay, anybody else wishing to address the board at this point? Mr. McDonald?
I have a couple of comments which will lead to a question that both of them can answer.
No, they are not. You will address the board. Okay.
Who decided that?
Our attorney.
Well, in that case, I'll just leave it to the comments. I would think that somebody who stands up here and criticizes somebody who's not present, I've stood up here and criticized people to their face for their work or lack of work or differences in our opinions about it. I think that if you're criticizing somebody from a past board without them being here, that's kind of gutless. And to me, it sort of nullifies an applicant immediately. So I think we know which candidate I prefer just based on that alone.
Okay, thank you. Anybody online wish to comment?
Linda Williams had her hand up, but I don't see her right now. Oh, there we go.
Okay, Ms. Williams?
I have to figure out how to make sure she can actually talk. Hold on just a second. Okay, Linda, you should be good.
Okay, how's that? There we go. So my question was going to be for the candidates, but I'll rephrase it in that I am hoping that both candidates have a clear understanding of what the healthcare district's responsibilities are. And I was hoping that either both of them or one of them would jump out there and explain their understanding of what the district does in coordination with the hospital. So that's kind of what I was wondering.
Okay. Anything else at this point?
Not from me.
Okay, great. Any other public comment at this point? Okay, well, thank you. We're done with that. So then we're now at the point where we can get into the actual election. I'm wondering, Director McGordy, do you have a motion you'd like to make at this point?
I'm sorry,
Would you like to make a motion at this point?
about a candidate?
Right.
Well, I asked both of them to apply, so I'm kind of torn, I think it'd be better to just have a poll about, before we move to a vote, just what people think.
Well, we should have a motion upon which
Okay.
that we discussed.
I can put a motion on the floor, and then that can be up for discussion, and maybe it dies for lack of a
Yeah,
second.
right.
I don't know. I would move that we appoint Michael Blaisdell to the vacancy on the board.
Okay, is there, and I'll second that. Okay, so
Okay.
let's start, now is there discussion? Would you?
Discussion.
Yeah, go ahead.
Like I said, I asked both of them to run, and Michael's been really helpful on the planning committee. I think Emily has a lot to offer. I would vote for Emily, just because, I've worked with her before, and she knows how to be diplomatic in her speech, which she complains I don't. So.
Any further discussion?
So I could speak to my motion?
Yes,
and why I
please.
said it. Because when this whole thing came up, I was really reminded of, if you remember, once upon a time when Paul Katzef wanted to step down so that we could appoint both people. And I honestly considered doing that, because I can tell you and everybody out there that I'm really feeling my age, and I am not going to run for reelection at the next time. And so would really be interested in making sure that, and there may be other people that come up, but that we would have more than one seat to fill after it coming up in the next election. So hopefully we get to eventually have both of them. But I think, and the reason why I was very comfortable making the motion is I have really respected listening to and working with Michael. His input, I think, on your planning committee was absolutely excellent in helping us to get some additional resources that we really needed. And I think he'd be a great addition to the board. And this is going to sound really weird. I'm also a little bit interested in some gender equity.
Oh, yeah. 1, 2, 3.
Yeah.
Good point.
Okay.
So that was my reason for making the
Okay.
motion.
Any more discussion at this point? Okay, well, let's have a roll call vote then on your motion.
I gotta find my piece of paper. Okay. Lynn Finley.
I'm abstaining.
Okay. Paul Garza.
Michael Blaisdell.
Yes, and
Yes.
Jan, excuse me, McGordy.
I'll abstain also.
Okay, now that means we don't have enough votes to pass.
That's
And
right.
is that the intention of the board? Because I would vote yes on the motion. So there's, pardon?
I think you should take Michael. He's willing to run. He's been helpful with everybody he's worked with.
But the discussion is at this point with the board. So my understanding next step would be an alternative motion, if someone else has another motion to make. Or if anybody who voted in the majority or whatever wants to reconsider. Or we talk about why people feel they want to abstain, so.
I can reconsider since Emily is graciously conceding to approve.
So you would reconsider your abstention?
Yes.
Is that allowed, or do we recall?
Yes,
the-
absolutely.
Okay.
You can reconsider.
So recalling your vote, so how would you vote on the motion to appoint Michael?
Yes.
Would you vote yes? Okay. So then.
That's 3.
That's 3.
Okay.
Okay, so the motion passes. Mr. Blaisdell, welcome. We'd invite you to come up and sit with us. However, you cannot vote until you have filed the affidavits that have been filed with the registrar's office, which hopefully will get done right away, certainly in time for the next board meeting.
Yes.
But please join us.
Chair,
But first,
yeah,
to make it official,
Yeah.
the secretary can.
we have the oath of office. Don't go away. Where are you going?
Well,
Okay, so you need to stand up and
stand
raise
up
your
and
right
raise
hand.
your hand. And you need to go to the podium for this.
And raise your right hand at the same time. Okay. I, Michael Blaisdell,
I, Michael Blaisdell,
do solemnly swear or
Do-
affirm
do solemnly swear or affirm
that I will support and defend the Constitution of the United States
that I will support and defend the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
and that I will bear true faith and allegiance
and I will bear true faith and allegiance
to the Constitution of the United States
to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
that I take this obligation freely
without any mental reservation or purpose of evasion,
without any mental reservations or purposes of evasion,
and that I will well and faithfully discharge the duties upon which I'm about to enter.
and I will give me that one again.
And I will well and faithfully
I will well and faithfully discharge the duties
upon which I'm about
upon which I am about
to
to
enter.
enter.
Congratulations.
Cha, cha.
Congratulations.
So before you leave, we need you to sign this, and then we need to file it.
Well, I was heading for the chair of this.
Yes,
Oh, you
please do.
can.
Okay, okay.
So Emily, you want to be on the
Welcome.
planning committee?
And I want to thank Mr. Strachan and for her interest in our healthcare board. I do think that she is very well qualified to sit on this board, so I hope that we will see her more often. And I also want to thank Mr. Maroney, who had at one point an interest in this, for his work on, as I continue to say, he's the most committed member of the public, serving on both Measure C and our planning committee. So thank you, Gabriel, for your service. It's appreciated. Okay. So moving on now, let's go to reports. And I have the first report here. Don't have a lot to say tonight, but of course the big thing is on top of this is the rural health transition and how that's going to impact us. We're going to continue to update via our website information about this. This is the rural health transition is the federal initiative as part of the big beautiful bill intended to preserve and improve healthcare in rural areas. Our hospital should be a beneficiary because of our status as a rural, frontier, and critical access hospital. We get all of them, okay? The district, however, is not eligible to receive any funds from it because we do not operate the hospital. So we will not be, the district itself will not be receiving any funds. Each state must submit an application for funds, and the California Department of Healthcare Access and Information, HCI again, has submitted this application. And if you want more information, we have a website here that you can go to. HCI has published a full analysis of this initiative in a short executive summary and a more extensive slide deck summary. You can find both on our website currently and are included in the agenda package for this evening's meeting. Okay. The maximum amount of funding for any state is $2 million per year for a total of $1 billion for the 5-year period. Now, $1 billion sounds like a very substantial amount of money, but our state has 279 rural health clinics, 20 tribal healthcare clinic systems, 296 federally qualified healthcare centers. Our Mendocino Coast Clinic is one of those, and 108 rural hospitals. Interestingly, over 82% of all census tracts in California are rural and qualify. So HCI is forming a statewide rural healthcare policy council to advise on policy, to assure policy alignment, and guide reform efforts. And its role is to act as a convener and facilitator in fostering collaboration. But you can see that while initially it looked like it's a whole lot of money, there's going to be a whole lot of people at the table seeking those funds. I would editorialize just a bit more and say that it's a little disappointing because this same amount of money is going to states like Idaho, Wyoming, North and South Dakota, Alabama, Mississippi, et all of who, Vermont, New Hampshire, all of who have very tiny populations compared to ours. California has, over 3.5 million, I believe, rural health residents. A very, very substantial amount. But it is the way it is. I want to draw your attention for information purposes, page 16 of the slide deck, which I think for those people who are just trying to get a feel for this is probably the best of them. It's a brief overview of the use of these funds. So they're to establish regional hub and spoke networks that will expand access to specialty care. Okay. To create a digital nervous system of telehealth for access to specialists. So this is e-consults and patient self-monitoring, part of the telemedicine movement. It will expand and support, or could be used to expand and support rural health capacity in obstetrics, especially, and in the development of allied health professionals. Okay. And transportation payments to financially distressed rural hospitals in important, significant areas. Regrettably, for the district's tax ahead, none of these funds can be used for construction. Nonetheless, our hospital should benefit. Probably the best example of this would be to support the deployment and implementation of a new patient electronic records, or known as EHR, information system. And the one that Adventist Health wants to deploy is called EPIC. I thought it was Eric, but I guess I got that wrong. Thank you for that correction.
You're welcome.
Okay. Okay. The system enables an individual's medical records to be accessed anywhere in the country. So it will make medical records available upon demand to treat a patient regardless of their geographic location, health system, or insurer. So that could be a major step forward. As we learn more, we will post more information on our website, and I encourage you to watch for the updates. Okay. Now, with respect to the other thing I wanted to mention tonight, I just call it gratitude. We're on the verge of our upcoming holiday season, and it's a traditional time that we express our gratitude for the life and community that we all enjoy. And I believe that we all have a whole lot to enjoy in this particular community. We're very privileged. I want to especially recognize our staff, Ms. Cassie Wiley and Mr. Wayne Allen, for their dedication and outstanding work. I also want to thank our attorney, Craig Steele, for his and our many consultants, including the Devaney Group, Regional Government Services, Building RX, and Props and Measures for their work on our behalf. Further, I want to thank the dedicated staff at HCI for their assistance and guidance. It's been invaluable. Our hospital has moved from being an acceptable hospital to a very good one. The current scores on national metrics demonstrate this. This kind of progress only happens with hard work and dedication. So I want to therefore especially thank the Adventist Health staff of our hospital, the physicians, the nurses, the allied professionals, the administrators, the clerical support, maintenance, and cleaners. And remember that we were recognized, our hospital was recognized as one of the cleanest hospitals in the United States. For their efforts on behalf of all the members of our community. We are grateful for your work. Okay. And so now our next report is, get back to my, if anybody wants to cue me up, they can.
It's Donna.
Are we at Building RX?
Yes.
Okay. Ms. Huntingdale, Building RX, please. We're looking forward to this report very much.
Yes, thank you for having me. I'll go ahead and share my screen. Oh, I need to have access. Okay.
Just 1 second, Donna.
No worries.
Try again.
Okay, well, I guess I can take my seatbelt off for this. Okay, so thank you for having me at the present to the board. And Paul, thank you for those wonderful notes of gratitude. I'm going to start with the summary and then briefly go through each of the backup documentation items that we have here, and then follow by asking for any questions that you may have. So since the last meeting, we have been able to refine the budget and really understand where all the risks are, talking with both Devaney Group and Cumming to understand what the estimated construction costs are. Where we've landed is we believe this is a 19,925,294 is our estimate for the project, including a 10% contingency, potential coverage for potential costs to make sure that you guys are covered from these costs that may happen but may not, depending on as we go down the path of further project development. We will determine what is needed as far as the CEQA analysis is concerned. If the tank needs to be above ground, there will need to be some kind of CEQA analysis and the associated costs. Similarly, costs for Coastal Commission, if there's moving in and out of spaces, those physical moves as well as the resulting cleaning, and also incorporates a 10% escalation on the construction costs. Those construction costs are directly from Cummings estimates, and then the soft costs additional to those construction costs are based on using Cummings as a temperature gauge, if you will, but also using my experience to allot dollars for the different soft costs that likely will arise through the development of the project. For schedule, I did not make any changes to the schedule from the last report. The Gantt chart does outline the path to Senate Bill 1953 compliance and estimates completion of that compliance in Q1 of 2031. The next major milestones include getting HCI on January 1st, the seismic compliance, or by January 1st, seismic compliance plan, AB 1882 and AB 859 documentation, as well as we need to get a consultant we have to get a contractor on board to do the above ceiling survey for NPC 4. And so we will need to do that at the beginning of 2026. And then NPC 4 and 5 submission to HCI is due by March 1st of 2026. So those are the next eminent things that need to happen, but the schedule is provided as backup to this document. Cash flow. So because my contract is a 3-month contract and the way the board meetings laid out, I'm doing an extra presentation at the next board meeting, and so was advised to that I could hold off doing the cash flow, but for my final report, it will include the budget, the schedule, the cash flow, and then the next steps. And that will be at the December board of directors meeting. Since the last meeting, we have had further developments through both refining information with Devaney, as well as working with HCI to make the official request to them of the 1.128361 for the first grant value. Including 5 contracts from Devaney Group, 1 from SHN Engineers for the geotechnical contract, as well as the Building RX contract. We are told to estimate approximately 90% of that to be funded, slightly less than that 90% to be funded. We wanted to note to the board that there were 2 of the past Devaney contracts that did not qualify, one being the scope associated with exploring the potential for rebuilding on the bluff, and the second is for the ED and surgery upgrades contract that was that Devaney Group led. Once the grant is finalized, funds will be dispersed upon getting HCI the district audits and us providing them the invoices and associated canceled checks to show that the district has paid those costs. And then the way the grant works is that at that point they will get those funds will get reimbursed. Subsequent grant requests will be made once the construction costs are contracted. And again, next steps would be summarized at the December Board of Directors meeting. So what you have in your backup, along with the acronyms key, is the summary of what those HCI grant requests are associated with each lined contract, the overall budget. The way that this reads is, get it on the screen here. Is you've got the what the budget is, you've got the committed costs, what contracts you have executed for the total amount of the budget that you have committed for spending, and then you have the last 3 columns are related to the costs. And so you'll see what the costs are to date the dollars that have gone out the door, so to speak. And then I did add some notes here for you to have clarity as to what is included within each of these construction components. Um, Noting that right now I have a zero amount on a couple of these, but I'm noting that those funds are within the estimates for the other line items. And once we get some more clarity between the division of those funds, we can populate each of those lines independently. And then again, as reported, the total bottom line at the 19, just under 20 million as the project costs, and then reattaching the schedule here for your reference. So with that, I will take any questions you may have.
Director McGordy?
Yeah, first I want to thank you for your report summary. I'm really happy to see some narrative, and I like the way you organized it by subject. So just to confirm my understanding of progress, in your contract, you stated we would have a schedule for the master project. Is that what people are calling the Gantt report, this
Yes.
thing? Yeah.
Yes.
So, I find that timeline really difficult to process. Is it possible to condense it into one page? So a snapshot of the dates and times would be very helpful to share with the public. I mean, it's impossible to understand the way it is written.
So what I had presented at the last board meeting had the dates pulled out from that. Would it be acceptable for me to pull that up as an example to see if that meets the need, or do you want to take a look at what was provided last month and see if that meets the need, and communicate with me if that's how you would like it done in presentation to the board?
Understand that.
What she's saying is that this was presented at the last board meeting, and these are the dates, and she's asking you, is that the format that you want to see it in, or are you looking for something else?
No, I'm looking for a timeline that's on one page. I mean, it's, like date.
Would it be
time.
acceptable to share the report that I gave last month, just so that I can show you how I was trying to make the Gantt chart more, pulling out the information from it to make it more clear, and just to find out if that's meets the needs of the board, if that presentation meets the need of the board.
So a timeline that has lines and dates, right? And then, but it's all condensed on one page? Isn't that something that's standard?
What I'm not sure about is on one page, because, I mean, this is a pretty detailed
Yeah,
project
I-
with
I'm sorry to get it on one
multiple
page.
steps. But if I'm understanding you correctly, what you would like is like tasked to be completed by budget where we are. Does that do what you want?
Well,
But
yeah,
for each task, because they may go on beyond just one page.
milestones, yeah, I mean, it could be separated by milestones, but we need to know what those are because we don't really have an idea of that yet, really? Like, we haven't done
Okay,
the MTCAP and,
So maybe I make a suggestion that you work together with Donna and I, and we'll try and figure that out rather than take
Okay.
board time tonight.
sure. I had another question. So also in your contract, you said that it would include a proposed scope for Part 2. And looking at the budget, I'm assuming Part 2 would be the project management for the duration of the project, which would be $1 million plus $60,000 for reimbursables. Is that correct?
That's an
is that your
estimate
scope
that I
too?
put. I'm sorry to interrupt.
What?
I'm sorry, I interrupted you. Go ahead.
She thought she interrupted you. Did she?
No, that was a question.
Okay, so the $1 million that's in there is an estimate, and we are in the process of putting together that proposal, and we'll working with Kathy to for the best way to bring that to you.
And then my question the board would be, is that going to be open for other people to make proposals?
I can answer that. The plan is that we would put it out to bid for the three contractors that we put the initial bid, Donna's bid out for. And there may be others. I can go to construction.com. There's a couple of other places where we could put that out.
Great.
But it will be competitive.
So, and then we need to know where we are in the compliance plan for the seismic upgrade that's due January 1st.
That's in my report tonight, Jan.
Yeah, I know that, but my question is, who's doing it? Also,
Donna and I are submitting that.
Who is doing it?
Donna and I are submitting
You're creating
that.
that plan?
Yes,
And also the application for the delay of construction?
yes.
Okay.
Thank
All right.
you.
Thank you.
Other questions? Okay, hearing none, I thought you had one. No, okay.
No.
Fine. You don't have to have one.
I usually do.
Okay. Now we're on to, I believe Mr. Allen is next. Am I checking my agenda?
Okay, Wayne, we're ready for you.
Mr. Allen is going to give us a much more thorough, I gave you a very high level kind of overall of.
Okay, are we
health, but
ready?
He's going to
Yeah,
go
okay.
into, just one moment, Mr. Allen. He's going to go into much more depth, which I think is important that we get grasp us as fully as possible. So Mr. Allen, please.
Go ahead, Wayne.
All right. Chairman Garza gave you an excellent summary of the program. I'm going to get into just a little bit of detail. And Kathy, let's go to that 2-page abstract first. The HCI office in the state of California did submit their proposal to the federal government, CMS, Center for Medicare and Medicaid Services, and on November 5th, they have to wait till at least December 31st is the deadline to indicate the grant awards, the dollar amount, and so there's almost a 60-day wait period going on now. But what this abstract says in 2 pages, if you go down to use of funds, Kathy, I want to really emphasize this. I think you probably heard it from me before, but this is woven into the California response in several places. And I'm going to read the first sentence. The program will create regional hub and spoke networks anchored by hospital hubs and spokes that include critical access hospitals, clinics, birthing centers, and other providers. The state is really intense on this hub and spoke network, working it into the proposal and funding. And my opinion, I think some people will agree with me, but in my opinion, we already have the beginning of that in Mendocino County. We have 3 hospitals under the management and some under the ownership of Adventist Health. And we have a hub and spoke network informally set up. So we're well on this track, and that puts us, I think, more in the driver's seat to deal with HCI and receive some funding for what we're doing and what we need to expand. So it puts us in a good position. Okay, let's go to the three, and then in the HCI, you have to submit at least 3 initiatives out of 5 that the government has suggested. And I'm going to go to those 3 initiatives right now. They're in the slide deck on page 16. Kathy, it starts there. And once again, it starts off in that left-hand upper corner with the hub and spoke networks, and then how they're going to use that to expand the rural workforce capacity, as well as some transformation payments to help out, and creating what they call a digital nervous telehealth system. So they're playing very aggressively off a hub and spoke approach. Next slide. Next initiative is the workforce development, and that deals with really just recruitment and retention that Adventist Health is going to be doing, and their proposal to HCI to get some funding helping with recruitment and retention. The last initiative gets into what Chairman Garza also mentioned, is the electronic record, the infrastructure enhancement. And we desperately need that electronic health record and the other technology that goes along with it. So that'll be a beautiful initiative to put on the Mendocino coast and the hospital. So all 3 of the initiatives are pertinent to our operation. And even though we're not the operator, we are the secondary part of that. We're letting them be primary, and we will play a certain role as a secondary spokesperson. And Kathy and I have a meeting tomorrow morning at 9 a.m. with some people about this subject and what do they have in mind, and see if they've got anything reduced to paper. It may all be just talk, and they're developing their plan over the next 45 days. But we're going to be a part of that and bring in the board at the appropriate time when we have some facts. So the most that can be achieved by California is 200 million per year for the 5 years, which equals $1 billion of funding. So with $1 billion of funding, you can hopefully do a lot, even though there's a lot of entities out there. Some of those entities are not going to qualify for very much money, or if anything. And it's very clear to me in their beginning hub and spoke situation that they've got critical access singled out, and they've got the hub system. And very frankly, I think it's a very, very, very good beginning, because that's the way healthcare is going to transform in the future. All of these spokes that we've had that have been left alone, well, some of them have gone bankrupt, and some of them have gone out of business, and some of them are struggling. So the spoke system that we have now isn't working. We've got to get a hub relationship going. So we'll see how that plays out. And those would be my beginning comments about it. There's lots to learn here in the next 45 days. And then supposedly, if, if California gets awarded the maximum of 200 million, that'll be known. And that's, then like I said, it'll be $1 billion over 5 years. And they need to start working with the appropriate entities to get that money and that program underway. So and this whole process was application was a 5-year grant. You do not go back on U2 and get a different grant year 3. You're going to be granted that lump sum 5 years. Lump sum 5 years. So that's beauty of that also is you know what you can do and you can plan a little bit. You don't have to worry about going back and asking for more money in year 2 and 3 and 4. It's all going to be awarded. It's not going to be dispersed until year 2, 3, 4, and 5, but the money will be awarded on December 31. So comments, questions, I really believe Adventist Health, Mendocino Coast, that facility is going to stand a strong chance of getting some substantial money because of what I've been stressing here about the hub and spoke. And we desperately need the EHR, and hopefully that will be forthcoming. And Paul's got it right. It's not Eric, it's Epic. So and that's in half of the hospitals already in the country. They already have the Epic EHR. And we've got to have a communication system with patients where their medical information they can take along with them when they're traveling or doing various things away from their home and so forth. Right now, they go with no medical information, and that EHR needs to get into every single hospital. All right, let me pause, Mr. Chairman, and see if there are any comments or questions.
Yeah, certainly. And let me, just a real brief comment. Again, I want to remind everyone that one of the benefits that we have with Adventist Health, with this particular initiative, is that they are the largest provider of rural health care in the state of California, number one. And secondly, they have been heavily involved in helping the state prepare their application. So let's hope. So, Director Savage.
Okay, so just to clarify what exactly the parameters of this hub and spoke network might possibly look like. And I understand from everything that I've read, that's the direction that medicine is going, that we are going to have concentrated centers with concentrated resources that other entities feed into, and that's kind of the way it's going. But I also think if I was listening when we went out into the community, that that's in a lot of ways exactly what people were afraid of. That we would end up to be a pack and ship entity where whatever happens here, we'll get stabilized or whatever and then get sent someplace else. And that was a concern. And so I don't know if what this exactly looks like in terms of making it fit for how people feel who live here, at the same time being consistent with what's happening in medicine. I mean, I think there could be a kind of a thorough conversation here so that people don't feel that they've just been made into a teleport situation.
Yeah, I think that's a very reasonable comment. I think people are concerned about that. The good thing is it appears that while it's a hub and spoke, that doesn't mean that, for instance, Ukiah Valley is the only hub, right? That and everybody else is just a spoke. Because we're this particular hospital now is leading, for instance, in oncology services. And so and so the idea is, it's interesting to me because, oh my God, way back in the Carter administration, oh my God, was that a long time ago? There was an attempt then to create there was a national initiative to create healthcare planning, and this idea of hub and spoke was promoted very strongly in those days. And I happened in those days to live in Orange County. I was a member of the healthcare planning board in Orange County a long time ago. And that was their idea was to reduce competition and create greater efficiencies so that everybody didn't have to have everything. But it looks like the fiscal reality of the world has now forced that. So it's very interesting that this is now coming back. But I think we will want to, as you suggest, we will want to monitor this really carefully and see how it goes. I think it's yeah.
Well, not only monitor carefully, but I'm really hoping, and I'm not clear how the conversation happens and with whom as the fleshing out of what this looks like and who's going to be involved in that conversation.
Okay.
Because again, I think it's unfortunate if we go out and talk to the community and get feedback from them, and then the whole system moves in a very opposite direction without people feeling that they've been heard about what they need and want.
Yeah, and I think, I'm just, it's a good comment, absolutely. But I think people are mostly concerned that services they now receive here are not going to be closed down. They're going to be forced to go somewhere else. And from every indication I have seen is that doesn't make any sense for Adventists. They don't want to do that. See,
Well, again, I think the clarity that would be helpful is how is that conversation going to happen? What is the role of people out there who are concerned, or other of us that are on the board, for how do we have input into how they actually make it look?
Well,
Because again, I mean, you can draw things on a chart and on paper, but what that looks like when you've got 60 miles to travel over the mountain to get to certain things, and, that people are going to want to see, have some clarity and details about what that actually looks like.
Yeah, and I would just suggest, as you well know, because you've been through these kinds of things in your own career, it's going to take a while for the state to come through with that process there. They've made an application with the ideas that they have and what they want to do, but now they're going to create this task force, this council of people who are going to help them make the decisions, and it's a political process. It is a very political process, right?
Well, and what I'm interested in is how does Adventists develop what their plan looks like? As you said, again, I'm assuming we are not the only community. They are the biggest provider in rural areas. That we aren't the only ones that are probably facing that concern.
Director McGordy.
Yeah, I had a question for Wayne. So the third part of their application regarded technology, including electronic health records. And I know when we look at the needs of the hospital that are on our future budget, and there's like $6 million for the health records, would this take care of that so we don't have to pay it?
The comment to that, Jan, is yes, there may be some selected pieces of that KAKX list that could be put into this grant. So the EHR is the one that, is probably a very 100% possibility, and the others have some lower percentage. But yes, then we're going to go through that and look and identify and prioritize what we can do with that third initiative on technology. And on the other comment I want to make to Susan is the hospital is already a hub for the Mendocino Coast community. The hospital is a hub. We serve as a hub for the federally qualified health center, the skilled nursing facility, the medical office building, all of those things. We are the hub on the coast. But there is an expression, and I use it a lot, is you can't be all things to all people. So we're maxed out on certain services, and very frankly, we don't have the human resources that can provide certain services, and they never will provide certain services over here because of the economies of scale. So they have to go to a different hub. So we have one hub speaking to another hub. So that's all it's about. And it's similar to the airlines. You get into a smaller community, you don't have as many flights. You fly to LA and then you get your connection, or you maybe even have to go from LA to Phoenix to get a different connection on another hub. So one hub can hand off to another hub, but we're small and we are, I would consider a spoke, but a hub for the coast, all up and down the coast. So don't forget that in your message to the community. It's nothing to be feared about, because the fear would be if you lose your so-called hub, there isn't going to be any spoke. That spoke is going to be empty. So that's a real fear, and and that should never happen on the coast. But you can't be all things to all people.
More questions from the board at this point? Okay, now I know that this is our normal process would be to have questions from the public at the end of all the reports, but given how important this is to people right now, if there's no objection from board members, I'd like to put that aside and invite questions from the public to Mr. Allen about the rural health transition.
Mr. Chairman, I think, yes, as we get into it's the holiday season or something, it probably won't work. But as we get into knowing what AH is really going to propose, what their plan will be, we do need to have some public meetings about that. And it'll have to probably be in early January, because, the month of December, everybody's celebrating Christmas. So early first couple of weeks of January, I would start to push some community meetings.
Okay, again, now, any questions from the public at this point for Mr. Allen? Yes, please go up to so everyone can hear you.
Unless you're right in the mic.
No, I was just going to say I was spoked when I had a pulmonary embolism, and they took me to the hospital and right on the helicopter into St. Helena. And I also want to say I am a user, because I do a lot of medical care at Walnut Creek at John Muir. They use Epic, and it is absolutely wonderful. You get your results half the time before the doctors had a chance to read them. So that is a good tool. And at the hub itself, the only issue I have is that I arrived in St. Helena with no telephone, no way to call anybody, because I've forgotten all my numbers, because they're all in my cell phone. And so that was my big issue. And I said, okay, great, now that I've been here for 3 days, but I don't have any phone numbers in my head. So that was a problem. So there are companies that offer insurance, and it's not prohibitive, it's like $40 a month or something, that will guarantee you transport back to your home. So I would just say that that's one way that you can maybe alleviate some of the concern.
Okay. Okay, thank you for your comments. Now, again, I'm going to request that you keep these two questions to Mr. Allen. Okay, please.
Yeah, there's no one else online.
Okay, Mr. Maroney, you have a question?
Yeah, I just wanted to say, Gabriel Quinn Maroney. And to keep it to a question, it's my understanding that this is basically the hub and spoke. One, they had to come up with language and a whole system to get the money. And so they're bringing forth this plan, and that it's really about coordination and updating technology. But I do think that there's a lot of little details that should be watched, and that there's plenty of room to improve. And, you know, I think that the board in some way can take part in that by really looking at the intricacies of how this happens. As far as transportation,
Do you have a question, Mr. Maroney?
yeah, well, I'm asking him to
Okay, well then
comment on
please
kind of-
just frame it as a question to Mr. Allen, please.
Should I wait for public comment?
No, it's questions.
Okay. I'm done.
Okay, okay. Questions, again, people, you have questions about? I mean,
No, well, let me, I guess, do an answer is, if you have comments, get them into the chair of the board in writing, so.
Okay.
yeah, Miss, yes, Director McCarty?
Okay, so my question would be, do you think the state's going to take suggestions from, boards like ours on some of these needs that are being expressed?
Yes, I personally do. I think they will listen. It's a HCI division, and the 3 or 4 people that Kathy and I have dealt with recently are very good people to work with. They listen, and they're smart and cooperative, and I've been 100% satisfied with those employees that we've been working with. So
So then the question would be, how do we do that? What can we do to, ask the community what they're needed so we can make suggestions to the state? Is there a process?
the process would be with your staff, Kathy and I, doing what we do all week long and meet with people and visit with them and do that and visit with AH, but then also invite them to a board meeting. You had a couple times, 3 or 4 board meetings that you had an HCI representative making a presentation to the board. So they can come to a maybe even a December board meeting, or for sure a January one, and give their overview directly to the board. And the public can be invited and will be invited and participate.
Yeah, so it sounds
Okay,
like,
thank you.
yeah, it sounds like we need a special board meeting, one topic only. And so we'll look at an opportunity to schedule that. And I think that's a great way to at least get our discussion and our concerns heard at the beginning. Does it make sense to everyone? Okay. Okay, great. With that, Mr. Allen, I believe you also have the next report as well. That is from the received debt financing update from Wolf Hansen Consultants.
Okay, the next item, are we ready, Mr. Chair, for that?
Yes, go ahead.
Yes.
Okay. The financing for our bonds is taking a direction, strategy right now at the present time of being a short-term situation where we put some bonds into out of no more than a 5-year maturity, and those bonds would be restricted to only the seismic activity, the seismic expense. And I'm estimating the net value on that, the net cash outlay would be like 15 or 16 million. The 20 million that Donna used was gross expense, and we'll get an HKI grants and hopefully get it down to hopefully 15 or 16 million that we would have to finance for 5 years. And we're looking for an underwriter that would write that, and we would not pay any principal on it during the 5 years. We would only pay interest, so it would be very low payment. And then at the end of 5 years, we would either pay it back with the funds that we do have, the money that we have in our restricted capital fund, totaling about 16 million, would be intact during that 5 years, and in fact would grow because we'd be using borrowed money. And then we have to pay it off, we can, but at that point in time, in the fourth or fifth year, there's a lot of smoke and haze and confusion and frustration and chaos. I'll use all kind of terms out in the healthcare landscape right now. It is really a confusing market to work in, deal with financing, and it's got to settle down in the next 2 or 3 or 4 years because it's going to be some shakeout going on as far some hospitals are going to be going out of business, is what very frankly is going to happen. And so we got to let that settle down, and then at that point take another picture at what is our modernization needs at that point in time. What are they going to be, and how much they're going to cost, and deal with that whole subject again. So we're putting it in hibernation, letting it simmer down a little bit for the next 3-4 years, and then activate it in 2029 or 2030. And therefore, we're going after short-term financing. And at the next board meeting in December, to do that, I need to recommend an underwriter that can handle that, and an attorney that can represent us with the bonds. So I'll be making a recommendation to the finance committee and to the board on bringing those two entities on board. But financing it short term over 5 years, not paying any principal, interest only, and then dealing with the future and the modernization about 4 years from now, 3 to 4 years. Those are the comments. So, Susan?
I'm really confused about why we're talking about this, and so maybe backtracking just a little bit, because I have been on the assumption, because I've been watching those numbers, because my understanding, assuming that we're in the vicinity of 15 million when the dust settles for the cost of the retrofit, that we had the funds available to cover that. But now it sounds like you're recommending that we do short-term bonds that may or may not be paid back by the money we already have. I'm just really not clear why we're talking about doing this. And I'm sorry if I'm being obtuse, but I don't get it.
What my comment there would be is we are not slowing down the seismic at all. It's full speed ahead. We're putting all of our attention, and Kathy and I and Donna on that seismic project, meeting the deadlines and,
Got it. Yeah,
and
no,
doing
I'm not
that.
challenging that.
All that we're doing is not financing it with internal funds. Let's leave them intact and let them grow a little bit, and finance them with borrowed bonds. And then at the fourth or fifth year, if we have a we have more negotiation ability with HCI to get a loan because the seismic is going to be underway and I don't know, it's 50, 60, 70% done or something, some percentage, but we have more leverage there to do some long-term financing with HCI at that point. And that puts it in that posture. And that's why it's a good deal. Let's protect our short-term money right now, and borrow less, short-term loan also, and let's have some negotiation talk in the next 3 to 4 or 5 years with HCI about a 30, 40, $50 million modernization loan, very frankly, whatever it's going to turn out to be. So it gives us better leverage, better negotiation. If we spend our money out of the restricted capital fund, then we don't. It's not the best solution for finances.
In the bank that we could fund it all. But this is a better solution because it preserves as much of our principal for later for other kinds of things and puts us in a better negotiating situation. And it still enables us to do everything that we need to do.
Okay, and do we have
I'm like you. I am not an expert on finance. So I'm just,
well, because we're ultimately the ones that need to authorize
Right,
this. So I think
exactly.
the more we understand, the better.
yeah, absolutely.
So even a ballpark for what the interest, because you mentioned interest only.
They're going to do that at the next meeting. They're going to have a full report at the
We're gonna
next
have
meeting.
and right now, the estimate is that the total cost of the seismic is $19.5
Right,
million.
correct. I saw that.
Right.
So that's
No, but I'm
more than
looking
what
at
we
the
got.
interest on short-term bonds, which then becomes
Well,
an additional expense in the long run.
Or, but you remember that it depends on the interest rate there, because remember that we're getting,
that's why I was asking what it
we
is.
have the money in T-bills, and we're earning interest there. So it's a question of,
Well, exactly.
Yeah.
So how all those things dance together, I'm interested in.
and so that'll be a very important report next, from Mr.
Okay,
Allen next
so
month.
the answer is then more details on this and exactly what it's going to look like is coming, and this is a work in process.
Yes.
And I'm fascinated too, because, like I say, every time I listen to Mr. Allen on this, I'm learning something, so. But I will never claim to be an expert on finance.
Comment on that interest expense. Yes, the interest expense on money we borrow is going to be higher than the money we're achieving now. Right now, we're at about 4%. We'll be lucky if we get a loan of maybe 6 to 6.5%. So the interest expense is going to be higher, but that's not going to be a deal breaker. It's the better way to go financing wise.
Again, this is not, I'm just
And we'll
learning as
lay
you are.
this out in not lots of documents, some, the minimum amount of documents before the December meeting to show you how we're going to do it, what the interest expense and so forth. So,
Action item to you. So you'll fully understand what all the costs are. And, from what I understand, you would pay maybe 2% on that money, but you would preserve all of your 15, 16, 17 million for that 3-5 year term and put you, as they said, in a better
Well, and
negotiating
we'll
period.
see the numbers.
Yes.
But it will be a board decision about whether we're moving forward on it.
Yes.
Absolutely, it has to be. Has to be.
yes, it's absolutely a board decision, yes.
Okay, if there are no more questions for Mr. Allen from the board at this point, unless, Ms. Wiley, your report?
Wayne has one more on the
Oh.
audits.
Oh, yes, thank you.
Well, I'm not gonna put out any more schedules of deadlines and so forth, because this morning I got another request for 3 more missing items. There's so many missing items that the auditors and the bookkeeping service we got is coming up with. And so they got 3 more items I've got to spend 3 or 4 more hours or 5 hours finding. So probably, hopefully the next 60 to 90 days is all we can have the audits. So
Yeah, go ahead, please.
So,
In your mic.
this final audit's been promised for several months now,
Yes.
right? And it's a requirement for HCI. They can't do anything for us until we get the audits into them. And we're paying a huge amount of money for it, so 90 more days, really? I don't think, can't they hurry it up? We've been waiting and waiting and waiting, and is the board gonna be able to see any of this? Because last I heard, we were just waiting for last year's, and everything else had been done. Is that correct?
No.
No?
No, we, through the chair,
Go
we
ahead.
had, the 2021 audit is completed and it's an unqualified audit. You took the position that you wanted to see all 5 years of the audits in one package, and that's the best way to present it because it hasn't come before the board yet for 5 years. And in the meantime, we've had to Lutz, our bookkeeper of record on the audit, has had to create documents so that the auditor could audit our books. The books did not exist. And so now the books exist, and they're, as Wayne said today, they asked us for 3 other sets of documents that we have to scramble and produce. And then we got this information from the auditor. So the bookkeeper has done their work, and now the auditor is requesting this as part of the audit process. And, I just hate to say it, but we're not the only customer that they have. And they are coming on their heavy audit season because it's, December 31. And they're fighting staff holidays, people going on vacation for Thanksgiving and Christmas. So we expressed to them the urgency and, that a lot of our balls are dangling around finishing this audit. I did check with HCI. I was concerned that we needed to have the audits in order to submit for the grants or for the extension of the construction. And that's not true. Haley set me straight on that. But we do have to have the audits in order to receive the grant money back. We can apply for it, but we can't get the money until we show them the audits. So Haley is at HCI is aware that we're having these stumbling blocks, and DZA, Cami, is very well aware of our urgent need for those items. And she has agreed to be in contact with us on a weekly basis to let us know, where are we, are we there? And so I guess that's, Lynn was in on a conversation with the auditor the other day. I don't know if you want to add anything to that, but
I know that we really did stress with
you'd
them
have
how-
to talk.
We did really stress with them that it was really important that we got this information as soon as possible because we have a lot of things writing on it. But they keep finding things that are missing that we have to go back and create.
What year are we talking about?
So this is from, so 2021 was completed.
Yeah.
22, 23, 24, 25, the last year, right, that we just ended in July, June 30th. Those are the ones where they're still requesting some documentation. But the bookkeeper, Lutz, has done the books, and now they're to the auditor, and the auditor is requesting other information in order to complete the audit. So it's a two-step process. Step 1 is done, step 2 is sitting in the auditor's lap.
So are the things they're asking for, are they specific years? Which ones?
Yeah, there's specific years. There were no books that were kept.
So which years?
Well, to
21 through 25.
2022, 2023, there were no books.
Right.
Whoa, wait a minute.
Yeah,
There were no books of accounting through the local bookkeeper that we've been using all this time was not keeping any.
She did not receive the records from the treasurers, and she could not create books.
For any of the treasurers,
Yes.
including,
The last one. So 2021 isn't done then?
21 is the only year that is done.
So then what they're requesting is 22 on?
Yeah, the last 4 years.
Okay.
And of course, year 24, 25,
That should be okay, right?
we're pretty golden on that one.
Yeah.
We got to get to that year. And
okay,
then,
did you just say 24?
yeah, 24, 25, you know, when
Okay.
That was last year.
that was last year.
Yeah.
Right.
And part of the year before, you had staff, and we kept at least we have the records to give them to say, hey, create these books. So that's where we sit right now.
There has been an incredible amount
2022 to
of,
2024.
25, actually, right? We ended our year, we go on a fiscal year, so our year ended June 30, 2025, and that will appear as one of the audit records. You'll have that somewhere in the next 60 to 90 days, right, Wayne?
well,
Yes.
it's important to understand that part of what our staff has been doing is tracking down documents that we should have been preserved that weren't. So we have to go back and find bank statements. And banks don't like to be bothered with things that have been aged, and so they charge you things. And it's been,
It's
and
been
it looked like last month we were over it, and it was all going to get done, and then hiccups. It's just really frustrating.
Thank you.
Really frustrating.
But the good news is we don't expect any qualified audits. We expect unqualified, which means clean audits. The first year, of course, they're going to talk about our procedures, and they were wrong in the 2020-21 year. And as we've walked down the road, those have been corrected. So you will have, I am predicting, clean audits to give to lenders, to the state, to the county, to HCI, all the places that have been requesting these documents. That should have been kept by this special district all along.
Thank you.
Okay.
All of the audits, all 5 years of the audits will have an unqualified opinion, which is the highest opinion you can get. They will have deficiencies on internal control, missing things, which we're cleaning up, but they're unqualified opinions, and that's what you want. So.
Thank you. So I was working on this until 2:30 today with some of had to do with Donna and just getting some information. But I wanted to share with you that now December 1 is the Measure C Oversight Committee meeting. December 18th at 5 o'clock is your next board meeting. In terms of the seismic compliance and project coordination with HCI, in a recent meeting with the Department of Healthcare and Access and Information, HCI, Haley Shetty, Donna Honeydale, CFO Allen, and I reviewed the current project schedule developed through the contracting process. Design and permitting, phase 2, are underway, with construction for NPC 4 and NPC 5 expected to begin around June of 27. MT cap construction is projected for late 26 through early 27, and seismic strengthening is expected between 2029 and 2031. And that group agreed that these are conservative but realistic dates. In terms of grant and compliance deadlines, there are two separate tracking systems. The one is the grant milestones, financial and reporting dates, and there are no penalties for delay, but approved costs must be conservative for state controller review. And I think you've heard Haley say that, they look at that with a fine-tooth comb. The second track is compliance plan deadlines. These are the regulatory deadlines tied to AB 869 that authorizes HCI to grant eligible general acute care hospitals a delay of up to 3 years beyond the January 1, 2030 deadline for seismic compliance. And we have met all that criteria, except, as I told you, that we have to have the audits in order to get the grant money back. And I'm just going to pause this sharing because you can see it. MPC 4 and 5 evaluations were submitted in December of 23, and that met the grace period for construction extension eligibility. The compliance plan and AB 869 application must be submitted before January 1, 26, as you've already heard. While outside the scope of Building RX's current contract, Ms. Huntingdale has agreed to assist me with construction milestone date estimates for submission to HCI at no additional cost. I didn't put this in, but I expect to have those within the next 4 weeks. And of course, we'll meet that deadline for January 1. To qualify for reimbursement, the district must provide invoices tied to each milestone and proof of payment, like canceled checks. A tracking column has been added to our internal spreadsheet to show payment details. Other grant award notes: MPC 4 and 5 design evaluation costs are eligible for grant funding, as you've already heard. MPC 4 and 5 construction costs are not grant eligible. Reimbursement forms will be generated once the grant is officially awarded, and maintaining organized documentation of invoices, payment proofs, and milestone progress remains a top priority for grant compliance and part of my work. Ms. Shetty noted the state continues to award $1 to $3 million per month to qualifying grantees, and she emphasized the importance of submitting grant reimbursement applications as soon as possible. And of course, you've heard all the reasons why we're on our auditor to get that accomplished. In terms of seismic construction planning, Dudley Campbell of the Devaney Group is hosting bi-monthly staff meetings with subcontractors reps from Degenkolb, Cumming Group, Gaynor Engineering, BKF Engineering, Donna Huntingdale, AHMC Facilities Manager Peter Johnston, CFO Allen, and me. HCI structural evaluation comments received back were minor, suggesting there's no major cost changes anticipated at this time. And as Donna explained, with the built-in contingencies and all, you're right at 19.9 million estimate.
Oh, 19.9, okay.
We are currently working on the best path to MPC 5 water and sewer capacity requirements. The team is also currently working on schematic level NPC 4 and MPC 5 construction drawings to use as a bid set for general contracting. And I thought it was important to include some information about the healthcare shutdown ending. I wanted to call out that HHS is now fully funded again through the end of January, and the spending package also extends Medicare telehealth and the acute hospital care at home programs that lapsed when the shutdown began on October 1. The Senate passed the spending package on November 10th. Under the terms of the agreement, a vote to extend the Affordable Care Act ACA subsidies will take place in mid-December. Skipping down, a spokesman for the White House Budget Office said that the SNAP Supplemental Nutritional Assistance Program benefits will see their accounts fully restored within hours of the government reopening. And I could go on, but I'm happy to take questions. And I think Donna's still on the line if you have any questions for either one of us.
Okay, board have any questions? Okay. Mr. Allen, Director Finney, you have your treasurer's report now up.
Yes, I'm going to go ahead and give the,
You might want to take public comment on the report.
yes, true.
Before we move
Oh,
on.
this is yes, this is, thank you. This is an approval item, I'm sorry. My mistake, yes. Is there any public comment? Mr. McDonald?
Let's go back to let's just look at the agenda. The phrase that's used here is public comment. I think that this chair has got it wrong as far as the process of meeting goes. Once again, to claim that the only questions you could only ask questions of Mr. Allen about the RHT and associated topics it's just fumbling the ball when it's just right in front of you. People can make comments or ask questions or make comments that lead to questions. While we're on that, the way you ran the election of the new board member, you fumbled it, messed it up, created a whole lack of confidence in how it was done, asking Director McGordy to make a motion instead of asking, is there anybody on the board who would like to make a motion? Implies that maybe there was some agreement between the directors. I don't think there was, but that could be an interpretation. Believe me, I notice when people shake their heads at my comments, and I take that in as much as I take strident comments about committees of changing the name of Fort Bragg. Thank you.
Okay, thank you for your comments. Are there any more public comment at this point? Seeing none in the room, is there anyone online?
No.
Okay, thank you. Madam Treasurer, how's that?
Well, I will start with going over the check register and then leave it to Wayne after that. So the check register, we did have the payment to Let's for building the books. That check came out the 17th of October. That was for $8,132. That's for the years 2022 to 2025. And that's the people who built the books for us to send off to auditors. And the other thing I just want to point out was the props and measures. The $495, that was for a compilation of the community emails that they promised us. And that's our last payment, the last thing that we have going with them, as we discussed last month. Everything else is pretty much still standard payments, standard check register items. That's it.
So then,
And then it goes to Wayne.
Oh, okay, you ready for me, Kathy? Okay, the budget to actual report for October, and then the 4 months on the right-hand side. And I want to thank Susan for calling out last month. Yeah, it was last month. I had not put in an entry for the tax revenue that we received a month earlier. So I've added that in the year-to-date column, and you'll see that it was 107,421 for Measure C, and then 88,713 for the property tax. So that entry was entered into this page. It doesn't affect anything else, the cash position or anything else. It's just I did not put it on this form, so it's there, and it'll. I'm not going to make that mistake again. So you see, then on the revenue coming in this month, the investment income was higher because of some accruals of some of the T-bills, And now year to date, we're up to 193,353 for the 4 months, and a little behind budget, but that varies with how the treasury bills mature. So nothing there. Down in the expenses, number three, we're below budget because uh, people don't bill us. In this case, the biggest one is the RGS. There's no billing there, so that distorts it. And then we had another, that was the biggest distortion. So um, that will balance itself out as time goes along, 12 months goes along. So don't get up worried about we're good, we're under budget, or we're over budget, and we're going to be probably over budget all year long because of the amount of the tax assessment we got charged for collecting our taxes. That was run through projects and consultants, and you'll see year to date that was it's up to $30,000 and put us over budget. So and then the other restricted payments are the same. They don't change each month. So let's go to the second page. That's the operations, and then we have I set up a restricted capital fund where we allocate uh, part of my compensation and Kathy's, and then the other miscellaneous expenses pretty much get allocated on a 50% pro rata basis. So they're allocated into that area, and the same situation happens there of certain expenses don't come in, and so it looks like a favorable budget. So I'll continue to advise you as this time goes along if we're really seriously deviating from our budget. But I don't think we are, except that one entry I just said. And so let's go to the portfolio treasury bill. And there have six instruments that are being handled, investments, and the different maturities of 6 weeks, 13, 17, and 26. Clear over on the right-hand column, you'll see the rates are sitting right at 4.0 to 3.9%. So we're getting that kind of yield on those. And then in the accrued interest, if you go to the value investment income, the third column, Kathy, footnote A, but you'll see amount of 181,000. Go if you move that is the amount that is accrued interest, and as those treasury bills mature, like it's a little one. There was one that matured on November 6th, and I reinvested it for 3.97, but it matured, and so that $8,495 goes down into the matured category. You won't see it in December. It'll be out of there. And then about this investment income now through October is a nice 793,000. And I think we're going to be at $1 million by June 30, maybe a couple months before that. So we'll hit the $1 million mark. So that's the only comments there, Kathy. And then am I taking the cash position, or are you? Lynn. Okay, in the cash position, it hasn't changed except for a small amount of interest income. It sets at 158,000. The restricted treasury bills that we just went through have a par value of 15,293,000. And then our operations fund in tri-counties is 573, and the LAIF account is 646. Total of 16,671,000 of cash instruments, 16,671,000. So that's the end of that.
We're done. Could I make a motion?
Yes, please.
I move that we accept these reports, the register, the budget, the treasury bill inventory, and the summary.
Well, yeah, actually, pardon me, if we can hold that in abeyance, if there are no questions from the board, we can go out to public comment, but we should have that before we have a motion.
Before we have a motion?
Yeah, I'm sorry. You were so willing to do that, I thought, great, let's move on, but I thought, no, wait a second. No questions from the board, any public comment on the, Mr. McDonald?
I also notice who doodles while I speak, too. So on the check register, I'm pausing because I'm not sure that Director McGordy may be right that you can have a motion and a second, then still have public comment and further discussion. Anyway, that's just a thought for aside. On the check register, some of you will remember about a year and a half ago, actually I think it's a little more than that. Anyway, well, let's leave that year and a half part aside. It's been asked several times, going back to previous boards, that certain items on the check register need to have more detail. For instance, I mean, there's a relatively low amount for the law firm this month, but it would be nice for the full board and the public to know, is this $80 for a X amount of minute phone call between the CFO or the administrator or the chair to the, how it's broken down. Just the 4 or 5 invoices that make up the $444. For sending the chair to a workshop, $1,300 and the extra few dollars and cents. I think we need to see what that was for. How much was for the hotel? How much was for food? How much was for the travel? And there may be other categories where that comes into play. Some of these are obvious, like the payment to Bank of New York and things like that are recurring. I believe that the Brown Act, I'm trying to remember the exact code number, covers that sort of thing. Props and measures, it was already described by Kathy last time when we have something around $500. MCN, it's recurring. Marshall and his team, that's recurring. But some of these things, when they're just one time or it's vastly different, the law firm things can be quite a bit different from month to month. The public and the other board members need to see that. Just need to see some specificity in that. Thank you.
Okay, thank you for your comments. Are any more public comments? No one online? Okay, hearing none. Director McGordy, we have your motion. Do we have you want to say it again? Go ahead.
I move that we accept these reports from our treasury.
Is there a second?
I'll second. Oh,
Okay.
Lynn.
Go ahead.
Okay, good. Second.
Go ahead.
I'll
I'll
second.
put Lynn. Madam Treasurer.
Okay, so any further discussion? Go to roll call vote, please, Madam Secretary.
Okay, Paul Garza.
Yes.
Jen McCordy.
Yes.
I'm sorry?
Yes.
Yes, okay. Susan Savage, yes. Lynn Finley.
Yes.
Okay, it is accepted.
Okay, thank you. Now we're on to item 5B, and that is to receive and consider a recommendation for approval for a minor revision of Policy 11, disposition of district-owned surplus obsolete equipment and supplies to the MCHCD Board. Agency Administrator Wiley, this is your item with the recommended action to approve this minor revision.
Thank you, Chair. This is cleanup language only. There's no substantive changes to this policy. I went over this with Sophia Slivanov, and she suggested these minor changes. So it's policy cleanup to clarify and to clarify the policy better for the public and for you.
Public comment?
Yes, please, go ahead.
Public comment?
We have board questions first.
Well, yeah. Do you mind highlighting what are these minor changes?
You have a red line version in the packet, and you can see that we added some wording for monitoring and evaluating the equipment. And it was trying to make it so that we did not have to come to the board with a $100 hospital bed asking you for a surplus, that there is some authority there. And and actually most of these limits were already involved in the original policy.
Okay, and this isn't a red line version.
Keep flipping.
There's a red line in the.
Oh, this is what you're talking about? Okay, got it, okay.
Okay, other questions? Okay, here, oh, I'm sorry, Director McGordy, I'm sorry, I didn't.
I move that we accept the revision to policy 11.
Listen, public comment. Mr. McDonald.
I thought we did. the
Appreciate Director McGordy's reminders about public comment. I do. I mean, that's good. I think this is a softball question for you, Kathy. This wouldn't have had any impact on the
Hospital beds.
giving the beds to Dr.
No.
Bowen and Jessica.
No,
Yeah.
it just would have made it
Yeah,
easier.
I like to give you a softball once in a while.
Thank you. Appreciate that.
Okay, now, your motion.
I move that we accept the policy revisions.
Or we approve it, right?
Brace.
We need a second.
Is there a second?
I'll second it.
Okay.
I was going to let Susan do this at the time.
I can, but I prefer not to if I don't have to, okay. So, roll call vote, Madam Secretary.
Okay, Jan McGordy.
Yes.
And Susan Savage, yes. Lynn Finley.
Yes.
Paul Garza.
Yes.
Okay,
Thank
they
you.
are approved. So I believe
Now-
we're approving.
Item 6A is approval of the minutes from our last, this was
What?
You still
is-
have 5C
5C.
at the bottom of page 3?
5C, thank you. I knew there was somewhere there, and I'm missing something here, thank you. 5C, this is your item, Director
Well,
Savage.
sort of. I mean, I think the reason that I asked for some clarity as to where this conversation takes place is bits and pieces of that have come up tonight in terms of where are we headed, what are we doing, the conversation about short-term bonds to have the money available, and the modernization reference in there multiple times. Because what I'm hoping is that there is some arena where there can be a conversation about what is the plan, what are the options for where we're headed, because we've seen two different proposals, which I think Dr. Saran mentioned that he was suffering from sticker shock on some of them, but still, and a conversation about how we fund those. And I'm not sure where and when that conversation happens. What felt appropriate to me is for the Finance Committee to look at what funding options might be out there, to work with Mr. Allen and come up with some alternatives and options and do some homework. But that apparently didn't feel appropriate, so My concern is where and when does that work happen? My suggestion would be that there's a simultaneous thing going on here, that you have standing committees a la, or not counter to our notion of dealing with the seismic retrofit as a committee of the whole, but we have a lot of homework to do to figure out what the path forward is. And so it would be my suggestion, and I don't think this is an action item, I don't know, that we have our standing committees go to work and come up with what might be some options, what homework does need to happen. It could be that there's a recommendation that we need some different estimates of different things that we haven't really done for the planning committee to work on, and for us in finance to figure out what our options are for financing. But it feels that it's stymied, and that I would like to see us have a plan for how we have those conversations and move forward, and I'm just not seeing the arena where that happens. So that was the reason
Okay.
why I asked for the agenda item to be on there.
Well, I think that part of the conversation, if I remember correctly, was that we were, everything wanted to be done as a community, as our board as a whole, with anything to do with the seismic and the modernization. And having to have the specialists have to come and present at all the different committees was time consuming and costly as well. So they already have to come here for the board as a whole. I think that's what's kind of stymied it.
Well, and I'm totally in agreement that if we have a specialist presentation from Devaney or whatever, that we all probably need to hear it.
Mhm.
But I think there are some homework and some things to do to figure out who is it that we need to hear from, and what are the choices and options out there, and to be able to have a conversation, unless we're going to start having those conversations here at the full board to figure out where we're heading. Because I know that, and maybe counter to other people's perceptions, my understanding is there has been full commitment to taking care of the retrofit of the hospital from day one. Some ups and downs, but from day one. And to finding the resources to pay for that, that's been a given. But the question of what do we do in terms of the emergency room and the operating theater right now feels completely up in the air. And I'm not sure if the suggestion or the recommendation or maybe the decision has been made that we're not going to talk about that for 4 years, which I personally think is hugely unfortunate.
I don't know that
But
a decision has been made. If you will recall, what happened is that we had, we've known about the I think the seismic retrofit for a very, very long time. We've tracked that step by step, and we were on the verge of everything being executed that we need to for that, okay? Aligned with that, we were hoping that since we recognized for a very long time that the hospital is in great need of modernization, we thought we would get some efficiencies if we could combine seismic retrofit with modernization. And that looked like, and we got an excellent plan with a lot of feedback from the hospital staff, and we were all in those meetings together. And we looked like we had a pretty clear path forward, and then we also were offered financing to do that. So it looked like we hadn't made a final decision about going forward, but it looked like we had a path forward. Then what happened was, because of the clauses in the contract, the lease agreement with Adventist, Wells Fargo attorneys advised them that they could not offer the $50 million revenue bond term sheet. They have replaced that with a $15 million bond, which we can or cannot, it's up to us if we want to accept that. But so it looks like for right now, at this minute, we'd have to just focus on making sure we get everything done from seismic and start moving forward. And then we need to go to the process of looking at, as you suggest, where the rest of the money could come from, recognizing that, as Mr. Blaisdell said I thought very appropriately, we have the burden of understanding that this hospital is really old, and to make it viable for the next 10 to 20 years, we've got to, there's some other things that need to be done, some significant ones, which are very important to, I think, all of us. I think we all want to see that.
What you
So
just said.
so that's kind of where we are. I don't see it as being stymied. I think it's a question of step by step by step. And unfortunately, sometimes when it looks like you have everything you need, it turns out you don't. But that shouldn't stop us. I have, as I've reported to you before, and I've asked Mr. Allen, who's going to be talking with one of the finance guys from Adventist next week, to push hard because they had made a personal commitment to me as the representative of this board that they would offer us the expertise they have with the Federal Emergency Management Agency and the U.S. Department of Agricultural Rural Development Agency, okay? Because they have gotten significant amounts of money for their hospitals from those two sources. So I'm hoping that we can learn a lot as a starting point there. Now, there may be other things that we should be doing. One of the things I keep pushing Terry Ramos to do is to create a dedicated campaign to the Mendocino Healthcare Foundation for hospital modernization with a goal of somewhere about $20 million. So it would be something they'd have to do over a period of time. So I'm pushing that as well because I believe that part of the solution to this is going to have to be personal philanthropy. I mean, I don't know what we can get from the state. It looks like HCI is going to be as bountiful as possible, I guess if that's the appropriate word. But they will only cover things associated with seismic retrofit, right? They won't give us any money for modernization. That could change in the near future, but right now that's the situation.
Can I make a comment?
Yeah, sure.
I'm not sure if what you're doing right now is this the conversation at the board level about what direction we're taking, because I've looked back in the minutes and we have never taken a vote to suspend any immediate planning or anything in terms of modernization. We've never even discussed or certainly not voted on that.
I'm sorry, voted on what? I'm not following.
What you just said, if I'm not mistaken, and maybe rephrase if I didn't understand, that the decision somewhere along the line, in the face of mounting circumstances, is that we're going to full speed ahead on the retrofit, but any conversation about modernization is being held off.
No, I'm not saying any modernization is being held up. I'm saying we thought we had a path forward for
Correct.
that as well.
Correct.
But now we know we don't. So I personally, I still am very committed to that. It's a decision, a question of every board member. We have not taken a vote on it. You're correct.
We haven't, and so my request is that via whatever structure feels appropriate to this board, either this is something that there is an appropriate role for our standing committees to do to help with the groundwork that would need to be done in order to have an intelligent conversation at this level, so that we can start the process of looking at what our options and choices are in terms of modernization. And that could be that we have a 10-year plan for how that might happen, or it could be things that have to happen this year in order for that to ultimately happen in 10 years. But I'm concerned that that conversation is not happening anywhere that I know about. Now, it could be that you and Kathy and Wayne and Adventist Health somewhere are having conversations about this, but as a board member, I'm not hearing it.
I actually resent that a bit. There's nothing being done outside of this group. I'm not involved in it. Aside from asking for help from people, I'm not asking for anything that affects policy. And again, we had two large, very extensive board workshops just on this topic.
Exactly.
Yeah, okay. Director McGordy, yeah, sorry.
First of all, I would like to see a continuing item for the seismic upgrade project on our agenda. I mean, I understand we don't have old business on our agenda, but it would be nice to have that on our agenda so everything could be put under it and we can get it done all the way, right? And because this is life and death for our hospital right now, the seismic upgrade. And we should be looking at it at every meeting. The other thing is, let's reinstate our standing committees. I mean, come on, Susan, you're the one that stopped them in the first place.
No.
Yes. You're the one that complained, and I listened to that, and so I brought forward a resolution, and there was agreement on that. Now, we can turn around and go the other way. I don't have any problem with that, but I was responding to you.
Well, then there was a massive misunderstanding of what my position was, because what I was trying to suggest is that presentations like the one that was given by HCI to one of the standing committees that board members weren't able to participate in was unfortunate.
Yes,
and so
I
what we
agree.
were suggesting is that if there are presentations and expertise and things that the full board needs to hear, that the full board should hear it. And that would mean that there would be extra meetings possibly of the board for that to happen. It was never my suggestion, and I think I spoke against suspending the standing committees, because there is ongoing work that could happen, and maybe that, and determined by what this board wants to do, for where do the conversations happen about how we might proceed to start looking at options and choices for modernization. How and where does that happen? Now, it could be, because those conversations all had to do with the retrofit, and I think we're still operating under that assumption. But if we're talking about modernization, do you want those conversations here at the board, or is there a role for the standing committees?
Oh,
And I'm
okay.
suggesting that, since, as far as I know, there's a lot of choices and options that need to be fleshed out, that there is a role for the standing committees to do that, so that we can have that conversation here. But-
Okay, I mean,
Okay.
I just want to get our work done. Okay,
Me
so you
too.
tell me what you want to do. You tell me now which direction we should go. I just like to see things get done, that's all.
Okay.
So,
Chair?
whatever. Yeah, go ahead.
So on the seismic upgrade on every agenda, you're going to see everything that has to be a board action on agendas coming forward. And every time I have, well, every report, I'm trying to include as much information as I have gathered over the month in my admin report. So I haven't had action items per se on the agenda because they aren't ready for action yet. But when they're ready, then of course they'll be at the top of your business agenda. And in terms of the modernization, I could probably yield the floor to Wayne here, but I think the modernization falls in the same problem that you have with the other committee work, that if we're talking modernization, we're going to have experts in the room. And that was, I understand, the reason that you wanted to have everything be a full board meeting, right?
Okay, so for example, I'm assuming that we looked at one design that was in the $50 to $60 million range for changing and upgrading the emergency room. As far as I know.
No, there were three. There were three different designs for that.
Right,
And we
right, but there
reviewed
was-
each one, and that was the one that looked like the most viable at that time.
At that time, correct. However, it could be, and I don't know, we've never had that conversation, that it's possible that that amount of money is maybe out of reach, but we need more choices. Maybe, I don't know. Dr. Saran talked about the emergency room, that there were possibly less expensive options for dealing with the situation there, which as far as I know, unless something else has happened in the meantime, that any kind of costing of that, I don't know that that ever happened. I don't know. So
We did.
it
We
could
got the
be
costing.
that the
No, wait,
role-
hold
if-
it.
Can I finish, please? It could be that the role of either the committee or the full board, if that's the way you want to do it, is to figure out what is the information that we need to have, who has the information that we need to have, and where is the best arena to bring that information forward so that we can be efficient.
Okay. What
And
I'm
having that
troubled by
conversation.
is that we have had a very deliberate process. We did look at three different options. There's no secrets there. Dr. Serhan presented the feedback from the hospital staff, and we looked at them. The one that they thought was the very best was the one that would cost $109 million, I think, or something like that. There was also another one that wouldn't be nearly as effective, but could be, I can't remember the amount, but it was less than. And then there was the one that looked like it was reachable in $53 million. And at that point, it appeared that we could do that. So that's where we were. We didn't make a final decision to say this is where we're going to go. but that's kind of it was operating on our consensus that we thought that was a reasonable, the step that they're headed to. Then we ran into the financing problem. Okay, so now we're in a little bit different situation, but the momentum to do the seismic has not changed. That has been,
No, I'm not
since I've been on the
suggesting
board, that's all we focused on is seismic.
that. Okay,
Yeah,
but
go ahead.
I
that's
think
fine. Yeah.
Wayne might have something to say on this.
Well,
I think
let me add a comment, Kathy, okay? Uh, I didn't make my comment, I guess, strong enough in the RHT discussion about the smoke horizon out there in for the next 2, 3, 4 years is heavy duty. We're going to be in a smoke haze with state subsidies, federal subsidies being reduced or eliminated. The federal deficits, the state situation, that's all very confusing, and it would not lend to very much discussion, if any, probably nothing about having modernization projects. You can't plan them right now because it's a hand-to-mouth, payroll-to-payroll situation. These operators of hospitals are scared, frankly scared about the future. They won't tell you that publicly, but they will tell that to me privately, and they have good reason to. So to go out and say we're going to be planning operating room and emergency room and various things and waste time doing that during the next 2 to 3 years, well, is just wasting time because we don't know the landscape may change. Maybe there'll be no surgeries over here in Fort Bragg, maybe. And it is, Susan, it's a tough and very tough environment out there. And really it's the hardest I've seen in my whole career because there's problems. And this country's obviously at the federal level, 36 or 38 trillion dollars in debt. Well, that can't go on. It's not sustainable. And I guess the federal government now is trying to reel in some of these situations, but it's a bad situation. And if you want to try to face something like that, you're not going to have much credibility with it because I think things are going to be changing on every 3 or 4 or 6 months. There's going to be a big change, and so those so-called $50 billion of rural health transformation funds doesn't even replace the Medicaid payments that are being withdrawn. And so there's going to be a deficit there. And rural hospitals are really on the cutting edge of that. And then how much artificial intelligence, AI comes into this. I think we're not even in that game yet. And they talk about in that RHT about electronic monitors for patients where they can immediately send medical information and so forth. And so there's going to be some fantastic changes in 3 to 5 years. So that's my perspective to it. Keep your powder dry and close to the vet. Keep that cash that we have with U.S. Treasuries, and let's let the smoke clear. It's a bad situation to jump into. All right, enough of my whining.
Okay, so,
Okay,
okay.
okay, Director McGordy, go ahead.
Yeah, these are good questions. I really don't think we need to take a whole lot of time. I think if we have a planning committee, we can talk about that and make some recommendations. If we have a finance committee meeting, we can talk about it and make recommendations. If any expert witnesses come, we can have that at the full meeting. But when I was talking about, like, a new business thing, like have everything regarding the seismic thing under one thing. So we had Donna's report. We had this report on the financing. If it's all under the seismic retrofit, it would be easier to digest.
Thank you, Director McGurty. Your board business right now is seismic retrofit.
Right. I know.
Right? The entire agenda is seismic retrofit. I was only trying to isolate the reports
I know.
versus the action items. I don't know how to do it any other way because your whole agenda, all you guys are doing is seismic retrofit.
Okay. Can we go on?
Go ahead.
Yeah. The consent calendar. Can we go on?
Oh, okay. Oh, you're saying the, okay.
Do we need public comment on
Well,
this?
I'm not
No,
sure
no.
that I heard resolution to the Director Savage's,
Okay, if I
It's just
could,
information only. We don't need a resolution, right?
Well,
no,
I'd
but
like
there
just like a
is
little more information.
direction in terms of what the will of the body is for how we proceed. And I think we heard loud and clear from Mr. Allen that his recommendation is that we pretty much hold anything dealing with modernization off for, I heard 4 years, I'm not sure if that's
3 or
correct,
4 years
to
like
let
that.
I'll let the dust settle.
Okay.
That could be a direction. It could also be that we do want our standing committees to be looking at choices and options, looking forward, so eventually as the dust clears, we have some sense of what we're interested in, not preempting presentations of information from providers happening here at the board, but just taking a look at options to maybe streamline this process. If the standing committees choose that they want to do that. I don't know. But if it's the will of the body that we just leave it for 4 to 5 years, that's the decision. And that would actually be helpful to know if that's what the board wants to do.
Thank you.
Okay, well, yes, I think so. More to be decided, I guess. So let's now go on to our consent calendar, which consists of the draft minutes of the October 23rd, 2025 meeting. Board members have any questions about the consent calendar? Okay, is there any public comment on the consent calendar? Okay, hearing none, is there a motion to approve the consent calendar?
I'll make that motion.
Okay, second. Director McGordy, okay, roll call, please.
Okay, Susan Savage, yes. Lynn Finley,
Yes.
Paul Garza,
Yes?
and Jan McGordy.
Yes.
Okay, approved.
All right, any comments from the board?
I have a comment, but I don't want to say it right now. I want to leave.
Okay, okay.
Well, we do have, if I may, your next meeting is December 18th at 5 o'clock, and Director Savage floated a balloon about having some sort of potluck or dinner,
Christmas, something around.
something beforehand in the meeting, and I don't know the availability of the other board members. Lynn, I know you work, so I don't know what your schedule is. If that's something that you'd like to pursue, okay, I just need to have some consensus about that.
I might not be, I might be on my break at that point.
Oh,
Yeah.
you might be on your, yeah.
Yeah.
So I guess maybe I could just send around an email and ask what you think and what you'd be willing to do, et cetera.
Yeah, I think that's probably the best way forward.
Thank you.
Okay, is there now a motion to adjourn? Director McGordy?
I move that we adjourn.
Okay, is there a second?
I'll second that.
Second, okay. We have a roll call vote?
Okay, Lynn Finley,
Yes.
Paul Garza,
Yes.
Jan McGordy,
Yes.
And Susan Savage, yes. We are adjourned at
Okay.
7:30.